one, start.
Good evening all, and welcome to our first meeting of our first remote meeting of the Holyhead residents. I'm really looking forward to tonight. We're one of the guinea pigs because we're one of the ones that have wanted to do this early on. So please forgive us if we make any mistakes. So I just want to welcome everyone to this meeting this afternoon. Secondly, I'd like to advise you that we are recording this meeting, so anything you say will be recorded, and it can be used against you afterwards if you if you say anything that's illegal. So just be careful what you say because it's all being recorded. But we should have a good evening. We've got some really good presenters tonight, and I think we'll start from there. So the first person on the call, because he has to go quite quickly, is Dr. Justin Varney.
So just bear with me, Councillor.
Yeah, that's okay. That's okay. And while we're waiting for Justin to come in, we've also got Neil DeCosta. I'm not sure of Neil's title. He just does a bit of everything for the whole district. He's got the old district director type title, but I'm not sure what it is at the moment. But Neil is the producer, and is Bev on the line as a producer, Neil?
Hopefully Bev should be with us.
Okay, and Bev
she's just joined the meeting, so yeah, Bev's with us as well.
Okay, and at the moment, how many people have we got on the meeting? Do we know?
We're just checking that. I don't know at the present moment in time, but we've got 13 attendees at the present moment in time.
Okay.
Right. I am waiting.
What I'll do is, before we bring in Justin, let me just talk a little bit about the last 3 months. We haven't met for a number of months, and can I just say to all the residents of Holyhead that you've done a phenomenal job trying to work with me, but also working with each other to ensure we keep the ward working in these really, really difficult times. We've had a tough few months. We've had a number of very difficult issues in the ward, but residents have really stood up to the plate, and they've done a wonderful job. And I'd just like to thank you all for everything you've done. And I'd like to thank you all for just being my eyes and ears out there when sometimes I wasn't able to do what I normally do. So welcome. And I've just noticed that Justin has come online. Justin, can you hear me? Are you speaking? Have you got your voice on?
Yeah, can you hear me, Councillor Hamilton?
Great stuff. Neil, before I ask
Councillor Hamilton, yes. Yeah. I was just going to say that I'm going to send Dr. Varney live as soon as you give me the...
Fantastic. So Neil, as soon as you're ready, can I introduce Dr. Justin Varney? He's our public health director, and over the last 4 months, he has absolutely done well. It's not just the last 4 months, but since COVID has kicked off big time and become a pandemic, Dr. Justin Varney, Justin has done a phenomenal job, and I wanted him here tonight because I wanted him to just give us an overview of some of the things he's been doing over the last few months, which is many, but also just to tell us a little bit about some of the BAME issues that have been going on and what we've done as a council. And I'll hand over to Justin. Justin, over to you.
Great. Thank you, Councillor Hamilton. Just to give a bit of context, I'm the Director of Public Health for Birmingham City Council. That means that in normal times, I'm responsible for things like physical activity, healthy eating, commissioning of sexual and reproductive health services, those kind of things. And normally a small part of my job is dealing with infectious disease outbreaks, so outbreaks of diarrhea and vomiting, things like norovirus or tuberculosis. And since January, COVID has pretty much taken over my life and been a much larger part of what I'm involved in leading. In terms of where we are at the moment in Birmingham, we are seeing a smaller number of cases every day. We're still seeing between 5 and 10 new cases each day. We're sadly still seeing people dying from COVID every day in the city, but it has come down significantly since the beginning of this outbreak. And that is a reflection of all the hard work that you have been doing, staying at home, staying safe, washing your hands and keeping that 2 meters distance that is so important. And I hope that will continue, and I hope that we will continue to see these numbers come down. We do expect at some point there will be further data added, so the numbers might shoot up later in the week, but that will be artificial because it will be a bit of the fixing the numbers rather than anything else. I think what I really wanted to kind of focus on was 2 things today. One, to talk to you about test and trace, and then talk specifically about what we know about the impact of coronavirus on different populations, different groups within the population. So first of all, test and trace. If you have symptoms of coronavirus, so if you have a high temperature, if you have a new persistent cough, or if you feel that your sense of smell or taste has changed, then you need to ring either 119 or go onto the government website to book a test. And that will mean that you'll either be able to go for a drive-through test at the Edgbaston site or at the City Hospital car park, or you'll get a testing kit through the post. And they're getting results back to people now relatively quickly, pretty much within 24 to 48 hours of the test being done. If your test result is positive, you will then get a link to a website to go through where you've been and who you've been in contact with. And that will, if you fill that in, you'll either then get a phone call or they'll be able to know everything from the website, and they'll then contact the people that you've been exposed to, that you've been in less than 2 meters space from, to have a conversation. And those people will need to isolate for 14 days. You need to isolate for 7 days until you have you've resolved your symptoms. So that's the current approach with test and trace. We don't know where when the app is coming. I expect it will be in a couple of weeks. But at the moment, if you have symptoms, please get a test. That's the most important thing you can do. It helps make sure that if you get sicker, we know whether we are treating someone with COVID or not. But it also means that you are doing what you can do to help protect others and protect them from this disease spreading. Now, I want to move on to discuss what do we know about COVID and ethnicity and some of the other risk factors. Now, there's been a lot of research going on and a lot of crunching of the numbers. We had the national report published yesterday, which I'm afraid didn't add much to what we already knew from other research in terms of ethnicity, age or gender. But it did add some new information on areas like homelessness, for example, where we haven't had those numbers or that analysis before. There are several different risk factors, which mean that if you catch COVID, you are more likely to die from COVID. Most importantly of these is if you are more elderly. So if you're over 70, your risk of dying from COVID is much, much higher than someone who is under 40, for example. If you are very overweight and what we would say clinically obese, so if you have a body mass index of over 40, that increases your risk of dying significantly if you catch COVID. Men are at slightly higher risk than women. And if you have long-term conditions like diabetes or high blood pressure, then you're at higher risk from that as well, particularly if that is poorly controlled. So it's not just having diabetes, it's that your diabetes isn't particularly well managed. And that's a combination both of how your healthcare professionals are helping you to look after it and what you're doing yourself to look after it, and those two are kind of playing out. And if you take all of those risk factors, that explains a lot of the differences between different ethnic groups, but it doesn't explain all of it. One of the other factors that's been identified is occupation. Now, we don't think that's because particular occupations increase your risk of dying from COVID, but they probably increase your risk of catching it because you're having more face-to-face contact with people than people that don't work in those occupations. And we've seen that for not just NHS staff, but a higher rate of deaths than we would expect, for example, in taxi drivers and in chefs. So that doesn't increase your risk of death, but we think it's about increasing your exposure. There is no evidence yet that vitamin D makes a difference, and it's important to mention that. And I know that's a question that often comes up during this in terms of discussion and questions that people have. So at the moment, the advice for people is to keep your 2 meters of distance when you're outside of the house, keep washing your hands, and realistically be alert. You have to make a judgment for your own personal situation on whether it's safe for you to go out when you are out, to keep that distance. And you also need to talk about the people and think about the people that you live with, because although, for example, you might be a younger person, so the risk to you in terms of death of coronavirus is relatively low. If you live with your grandparents, for example, you will bring that back into the house if you're not careful, and that's a big risk in terms of that. In terms of testing, testing at the moment is just for people who have got symptoms. The reason that's the focus is that we know that because this test is like a giant cotton wool bud, you put it to the back of your nose or the back of your throat. It's not a very nice test to have done, I have to say. It's only able to find the virus that is at the back of your nose and the back of your throat. And in people who haven't got symptoms, they're generally, it's not that good at picking it up. So that's why we don't routinely test people who haven't got symptoms in that way. There's a question in the chat, which I'll pick up, around local rates of infection. At the moment, we only have case numbers for the whole of Birmingham. We do not have the information at ward level, and I don't expect us to have that during June at least. I am being promised it by national government and being told that it will come at some point, but there's no evidence of it coming immediately. And it will take some time for us to get it and to be able to then look at and calculate a local R. What I would say is across Birmingham at the moment, we are not seeing a large number of cases each day. And there's no evidence from what the hospital are able to tell us that they're coming from a particular area. So that is quite different to some of the position we've been in a few weeks ago. So I hope, Councillor Hamilton, I've been able to give a reasonable coverage of the topics, but I'm happy to answer any particular questions that people have. And colleagues, I have to drop off the call, I'm afraid, about 25 past to join another meeting, but I will do my best to answer what I can while I'm here. Right,
Neil, where will I find the questions? Please note, Neil, you're on mute. Neil, unmute yourself.
Hi, Councillor Hamilton and Justin. I can see the questions. So what I will do, I will ask them if that's okay.
That's
so just bear with me as I scroll through them. Okay, so there's a question about when can the public receive tests? Let me have a look. Right, okay, so Nina has asked when will all be able to get the test for coronavirus?
Yeah, so at the moment, anyone who has symptoms can get a test for coronavirus. So if you have symptoms, you can go onto the website. I'll try and put a link into the chat so people are able to see it. And you can go onto the website and book it through the website, or you can ring 119 to get access as well to a test. If you're someone who's working in a care home, it's a slightly different process for a care home, to be honest, but the care home managers know exactly how to do that. It doesn't make a huge amount of difference. It's still the same process in terms of getting either a postal kit or getting a drive-through, and there are plenty of slots available. There's not a shortage of slots in Birmingham, so people should be able to get those pretty easily.
Thanks very much indeed.
Can I ask a question while we're waiting, Justin, regarding risk assessments? A number of organisations and people are asking, are the councils supporting organisations to ensure that they develop the right type of risk assessment? How is that being done? Thank you.
Yeah, so at the moment we focused our support on schools around risk assessment, and the schools risk assessment is published. It's on the council website if people want to have a look at it and see some of the detail there. We're not providing individual support for different employers, for example, bluntly, because there just aren't enough. There isn't enough of me or my team, as you know, Councillor Hamilton, to go round and do that.
So that
no, it's a good question. So what we're trying to do is, so first of all, we focus on the schools, early years setting and education settings because they're opening at the moment. I am now talking to faith leaders about whether we can offer that similar kind of support and advice. So we don't do the risk assessment for you, but it's more that if they've got a risk assessment tool, then I'm happy for me or one of my team to have a skim through it and go, there's something really obvious that's been missed. And we'll do that with faith clusters. So we'll do that with the mosques and with the churches together, if that makes sense. So faith by faith, to help them prepare for July when we expect faith settings to reopen. In general, we're not doing it with employers. There's very detailed guidance on the government website for different types of employers, which I think is quite comprehensive. And most trade associations as well, or professional bodies have produced those types of guidelines as well. And we're working with the Chamber of Commerce. I'm doing some similar type Zoom calls with them to help answer questions. So where we can help, we are as a council, but I have to say we focused our efforts particularly on schools and early years settings to help support them as they're part of the first wave of opening. We'll move on to others as other things start to open up. But I would say to anyone, if you're starting to think through what do you need to do in a risk assessment, have a look at the government guidelines. There's a lot of stuff for employers there, and it will certainly give you a really good start of a 10.
Right, now we've been asked another question here by Ross Trafford. He's the principal of one of the largest schools in the city, and his question is around when will we know the infection rates? I do know the answer to this, by the way, or you'll probably slap my wrist, but they want to know, when will we know the infection rates for areas like Answorth and the Holyhead ward? Because at the moment, people keep talking about this R rate, but we don't seem able to get hold of the R rate. So what's happening in that area?
Yeah, so first of all, it's saying the R rate is the thing that's calculated based on the number of new cases and the number of deaths. So it's not a straightforward equation, and it's also tracking history in essence, because the deaths reflect the infection rate 2 weeks ago, not today. So there's a bit of kind of complicated maths involved, and at the moment we do not have access at a local level to that data to be able to do that for Birmingham. We don't have all of the data. Some of it sits with the Office of National Statistics, some of it sits in the NHS. So nationally, government are producing the R rate for England. There are some academic units that have produced regional R rates. So there is an R rate for the West Midlands and for the Midlands region, but there are no reliable R rates below that. And I know there are a couple of websites that are kind of saying we've got the answer. I've looked at them, they really don't, and they're actually really dangerously misleading. One of them yesterday said we had the same R rate in Birmingham today as we did in the peak week of the outbreak in the middle of April. And that's just blatantly not true. In the peak week of the outbreak, we had hundreds of people testing positive each day. So the idea that it's the same as today is rubbish, frankly. So I'm afraid we don't have that. I have been told by national government it's coming. I've been told that for about the last month. So we will see. But I would hope by July we will get much better data down to a much lower level to be able to give advice to teachers and other organisations about what's going on below the level of the city.
Right, now we've been asked two questions here because I know you need to go quite quickly, Justin. The first one is around surveillance and people socially distancing. What's been happening across the city? And the question was specifically around West Birmingham. And then the other question, another person highlighted that they've experienced people who have been spitting on the streets, and this scares the person, and can they catch COVID-19 as I pass or stand near in a queue? Can you give any advice? And then the last question, when people are smoking in front of me, should I be concerned that through the saliva I may catch COVID-19? So there's similar concerns. So if you could wrap that up, I will let you go at this point.
Thank you. All right. So in terms of monitoring how well people are abiding with social distancing, the main way we know about this is through the police. It's the police's responsibility to enforce the COVID Act, the requirements in terms of social distancing, of people not gathering more than in a group of 6 and keeping that 2 meters distance. And in general, what the police are telling us is that most people are being pretty well behaved and being sensible. You know, and ultimately, there's only so much we can do as a council or government can do. You know, it is up to each one of us to make a decision how we behave when we walk outside our front doors. That's the decision we make. It is our community. This is our city. If we choose to go out there and mess it up, we're not just hurting ourselves, we're hurting our families, we're hurting our communities. So, you know, we are keeping an eye on it through what the police are telling us, but there is a limit to what we can do to control people, and it is a space in which people have got to take responsibility. So the spitting and smoking, two slightly different things. So there's no evidence that passive smoking, i.e. someone smoking in the street in front of me, creates a risk. It doesn't ride on the back of little particles of smoke. I should just say though that smoking does increase your risk of having a worse outcome if you get COVID. So it is a good time to quit because it will improve your chances. Spitting slightly different. So spitting on the street, onto the street itself is not really a risk to passers-by. If someone spits on you in your face, that is a way that COVID can be passed. And there was a very sad case, I think, in London of someone that worked for TfL who we think caught COVID through a member of the public spitting in her face, which I think is just appalling, frankly. But someone spitting in the street beside you isn't really a risk, and we don't, and certainly in schools we know there are some children who have behavioural issues and spit with that, and again it doesn't really present a risk unless they're spitting directly into your face. So I wouldn't be as worried about that. But we do encourage people not to spit in public because it is a risk for other conditions like TB. So we would encourage people not to spit in the street if we can avoid it.
That is fantastic. Justin, thank you so much for coming on. And I do know you have another meeting to go to. So at this point, I'm going to wish you farewell, and I'll probably see you again tomorrow. But thank you for taking the time out to come to the ward meeting. So you take care. Take care. Good night. Thank you. We're going to move swiftly on because the time is really short. Sorry, I can't find my agenda. What a thing.
I've got it, Councillor Hamilton.
Who's the next person off?
Yeah. I would suggest, if you don't mind, asking Carl to provide an update and answer questions from a highways point of view. The reason being, police colleagues, unfortunately, are unable to join due to their technology. Right. So therefore, if the members of the public wouldn't mind sending any questions or queries through on the live chat, and what we're going to have to do is to seek to get answers for any questions or queries raised. Is that okay, Councillor Hamilton?
Well, we can't, if they can't get on because of technology, there's not a great deal we can do. And I also know, has Khalid managed to get on yet?
Not yet, I'm afraid.
He's not been able to get on either?
Not so far, no.
Okay, all right then. Carl, over to you.
Okay,
Carl,
thank you very much.
Come in at this point, thank you.
Thank you, Councillor Hamilton. Thank you, Neil, and good evening, everybody tuned in. My name's Carl Randall. I'm the local engineering manager for highways for Birmingham North, which includes a Holyhead ward and 22 other wards throughout the north of Birmingham. My responsibility is highway traffic management, safety, and implementing schemes to try and keep everybody safe on the highway. Those schemes include traffic calming, speed limiting measures, maybe zebra crossings, pelicans, pedestrian refuges, halfway crossing points. We deal with single yellow lines, double yellow lines, introduction of H markings to highlight a driveway access or disable bay applications. If people have a vehicle registered at the property but nowhere to park, we can arrange for a bay to be marked on the highway for use. We've been working in the Holyhead ward the last few months on reprofiling of the speed cushions on Regent Road. We had quite a number of complaints about the speeding and asked to reprofile the cushions. I had a walkabout with Councillor Hamilton and we looked at some of the issues around there and the feedback from residents who are concerned. We've had requests to look at Westbourne Road and other roads as well. So we'll be doing that over the coming weeks and carrying out some consultation with Councillor Hamilton and residents as and when necessary, depending on which road or roads are chosen for the measures. We have a small element of funding, ward minor transport measures funding that we use for this. And then there's other funding available should we be working with schools at a Safer Routes to School scheme, or if we are working on a local safety scheme. These tend to be bigger schemes and the capital funding comes from a central place for us to work on those schemes. I think at the moment we're trying to be business as usual, but everything is a little bit different. We are working from home, but quite effective. We have all the kit and technology that we need. All my team have CAD facility, computer aided design, so they can draw up schemes. We're working through some of the issues about consultation and about contractor engagement. Most of the contractors now are gearing back up to get back to work, so we can call on them now. We're not essential workers as such, but we are authorised to carry out site visits, so we're not just stuck at home. We can get out, we do site visits, look at queries, inquiries, assessments for new developments, for traffic calming requests. So it's not quite business as usual, but it's fairly good. And the longer we remain in this situation, the more we'll adapt to it. Councillor, I think that's a roundup.
Right. While I see the list of the questions, I'll tell you some of the questions I've had from residents. The first question is around the new umps that have been put in. They've been put into a number of places, not just in the Holyhead ward, but also in Answorth Wood ward. And residents are not pleased with them. They feel that they're lower, they feel that they don't do anything, and they feel that they're an absolute waste of money. Could you give us some feedback? Read those comments?
Yes, I am aware that Gresson Avenue was one of the roads of concern. We did carry out consultation quite some time ago in Gresson Avenue and sent out a letter and a plan with what we proposed there. The proposals were speed cushions. The two most common types of traffic calming, if you like, the vertical deflection, the ones that stick up, are the cushions, which normally have 75mm maximum height. That's what Birmingham use, and they are designed to be straddled by the emergency services, i.e. Ambulance and fire tender. That does of course mean that some people with larger SUV type vehicles can also straddle them, and some people do complain that not everybody reduces the speed accordingly. Now the speed limits haven't been amended, it's still 30 miles an hour. My view is, and I've been out there and I've been out twice and I've measured them, that they are at the correct height. If people are determined to speed, then they will do so, and obviously some people may be doing so in a vehicle that doesn't belong to them. They may not care for the vehicle as much as others do. What we do rely on, of course, is people adhering to the speed limits, or at the very least the person in the in front going at an appropriate speed over the cushions, and then at least everybody behind has to adhere to that. In some roads that aren't quieter side roads, perhaps not emergency service routes or blue routes as we call them, we have put the road humps. Now that's the type that goes more or less straight across the road, allowing for some drainage, and they can be more robust, if you like. People do tend to have to slow down more to go over those. They do work. They're not always welcomed by local people, who generally are the most impacted by whatever measures because they live there, whereas other people passing through, if they're unhappy with that type of traffic calming, may decide to go another way and use a different road. So when we consulted with Gresson Avenue, that was what was consulted upon, and we didn't receive any objections to. A little bit like that's what's at Regent Road and Westbourne Road at the moment, and other roads. It is something that can be looked at if for future traffic calming people do want the cushions. The hump, sorry, and if they are suitable for that road, if we're not likely to get objections from the emergency services, etc.
Okay, that is great. Can I ask you another question? I'm not sure if this is you, but I think it is. Are highways responsible for the grass verges?
Okay, the public highway is the road and the footpath, and that includes the verge if there is one. We're responsible for the maintenance. The actual cutting of the verge is highways, but it's contracted out to our leisure and parks people. So they are currently responsible for the number of cuts per year, etc. But yes, we are responsible for most of the grass at the side of the road. Slight hesitancy because we do have housing and other areas that may be responsible for the grass, but in the main it's highways.
Right, that's fantastic. Also, Carl, but I'm not sure this is you. Do you remember a few weeks ago we've had a number of big parties in the ward that has spilled onto the highways? Has any work been going on with yourselves, public health, the police, relating to those issues? I know what's been going on with the police, but with yourselves, have you been involved in any way?
Not specifically on that and in your ward. Citywide, we have been involved in emergency measures to try and create additional footway widths, but that's more to cope with queuing outside certain shops such as banks, building societies and supermarkets. So we have done emergency work on Erdington High Street, Ladypool Road, Kings Heath High Street, and there's some further measures hopefully proposed in other areas. This is where we're widening the footpath by banning parking and creating the extra width by allowing people to use what would have been a parking area. And we've been involved in conversations and meetings in Birmingham city centre about how to get the city centre back open, and specifically what we can do to assist on the highways in the city centre. We are rolling that out to look at local centres, and we are liaising with the bid managers of Sutton, Soho, Erdington, Kings Heath, etc. at Acox Green on measures that we may be able to do to assist with social distance markings, but not for parties.
Can I ask you another question then? I sent email to Carl and still waiting for a response. This is from Ian Bell. He said he sent you an email. He's still waiting for a response. Email I sent was in relation to footpath flooding, grass verge damage due to parking on the grass verge and on the footpath. Do you remember that email?
If it's Ian I'm thinking of, we have quite a lot of correspondence. I don't recall that particular one. It does happen. We have 60, 70 emails a day and we can miss one, or I can miss one.
So I'll stop you there and say, if you don't remember it, unless you can answer the question now, do you want us to resend you the email?
I could have a go at answering it, but I'd welcome a resend of the email as well.
So Ian, could I ask you to resend the email, but Carl will have a go at answering it now. Go on then, Carl.
What was the question in the email? Sorry.
The question in the email was that because people are parking on the grass verge and the footpath, it's causing flooding. So basically, he just wanted to know, is there anything that can be done? Yeah,
it is. There are things that can be done. It's a very big problem citywide. Parking on footpaths, whether that's the tarmac or slabbed footpath or whether it's a grass verge, it's a very big problem. Sometimes people are doing it because they haven't got parking, off-road parking, or they have more vehicles than the off-road parking can take. People shouldn't park on the grass and footway, and there's several reasons around obstructing others' passage, potential damage to underground utility apparatus, etc. Our powers are very limited. We end up having to spend a lot of money by either putting barriers around the grass, like wooden trip rail or metal trip rail. However, you can end up needing potentially hundreds of meters of this, and if somebody cuts away 6 foot of it, the whole thing's breached. We've tried an extra line of curbstones as a physical measure, But again, at about £70 a linear metre, total costs, that can work out at very expensive, because you can't and you shouldn't just do outside one house. That can look like you're targeting a property or the people, and we know lots of people do it, so you should do all the grass verges, but then it's quite a few £1,000s. We've trialled some areas in Birmingham where we have introduced no parking on the verge zone entry signs and exits, and repeater signs through the road, tapping into the overarching traffic regulation order for Birmingham. That tends to work. We do a consultation, let people know what we're doing and why. We need to know that the road can cater for the vehicles that come off the verge, because if we're banning parking and introducing a £70 fine if you're caught on the verge or footway, we need to know that if everybody parks on the road, they won't then cause congestion and access issues for emergency services, refuge, and everybody passing through. So there's various things we can do. We'd look at each location and decide what the best treatment would be at that location, and then it is subject to funding and priority, because we have many requests of this nature.
Right, great stuff. Can I just make a point before I ask you the last question?
Okay.
The point I want to make, this isn't about highways, it's in general. If Khalid Mahmood is listening on the phone, if he goes to his emails, which is it's Mahmood Khalid, I can't remember, Mahmood K at parliament. Whatever the email address is, you will see the invite that's been sent with the agenda. If you press on that link, you should get straight in. So I just want to say that aloud, just in case he hasn't had the information. Right, Carl, I know that we've had extra money given to each ward, but at the moment we've got a little bit of a plan going on where we're looking at signage, and we're looking at other umps going up the ward. But what I wanted to talk about was the fact that we've just been given the okay that you're going to do some work on Rookery Road. Could you explain to residents what you plan to do on Rookery Road and where's that money going to come from? Because I'm hoping it's not from the little bit that you give us already, because we have a lot of work to do in the ward.
No, you're absolutely right. We have got more money per ward this year. It's only a few £1,000s more per ward, but every penny counts. The Rookery Road, we had a petition received, signed by I forget how many, but a lot of residents and concerned people about the number of injury collisions on that road, and at least one fatality. I think it was said there was 2, but we went back 10 years and could see 1 fatality. So we totally agree that it's a problem, Rookery Road. The funding for it, we've taken it forward to what we call a local safety scheme. So there's a separate pot of money. It generally funds 2, 3, 4, 5 schemes across Birmingham, depending on the cost ultimately of what's required and deemed necessary to address those collisions and bring them down. The actual cost of this scheme, I don't know, because the stage it's at the moment, it's going through the different stages within Birmingham, the approvals. So Transportation Highways Group, the project definition document being drawn up, basically an options appraisal of what we could do and what that would cost, and whether we believe that would reduce the injury collisions. One of the conversations was around, would humps or cushions be acceptable on Rookery Road? Some concern has been raised that obviously we have the community fire station on Rookery Road. It doesn't mean we can't have cushions, but we would have to include the fire service with a consultation and take their views on board. also the emergency services, especially the NHS ambulance service, who have in the past quite rightly raised concern if they're transporting casualties, spinal injuries. They don't necessarily want to be negotiating speed cushions and humps. So we can certainly consider the cushions or humps. It probably would be cushions if any was agreed, but there's other things we will look at, like build outs, chicanes, flashing speed signs. There's a whole raft of measures that come under the guise of traffic calming. But once we are a little further down the line and we have approval to proceed, we will consult with you before making decisions on what to take forward. So it should be seen as good news, and it won't be your ward money.
Right, and just, I know I said this was your final question, but I've just been given so many issues. The last final question, which is the final question. A resident, I've had a number of residents come to me because they wanted to block off alleyways, especially the alleyway up at Newcombe Road and Uplands Road, the alleyway that continually is being used to dump rubbish, and it's an eyesore. Can you explain to us what can and can't be done? Please.
Okay, without knowing the specifics and doing a search, etc. In general, if it is a public right of way, which is something that the council and their service provider maintain, then that there is not an easy or quick process for closing that, because it, by its definition, is a public right of way where public can pass and repass unobstructed. I've only known in my area one public right of way to be closed, and to get to that level of closure, the residents, whoever would liaise with the police and the council's antisocial behaviour team, they would log the issues. If any interventions could be done other than closing it, then they should be done first. If ultimately nothing else will work and it has to be closed, then there is a legal process and consultation around that and pedestrian counts of who use it. If it was a housing access at the rear, then it's a consultation, conversation with housing, and housing have over the years gated off and issued keys, if you like, for those with a genuine need to use it, i.e. rear access. Unfortunately, a large category of these alleyways or walkways at the rear of properties don't fall under any of these, and they are just deemed to be private access ways. And by private, I mean there is no city council interest. There's no ownership or maintenance by the city council. If that is the case, and I can check any specific requests to see what the status is, then it's up to the residents collectively, because you know, in the main everybody would need to agree, and then it's the cost of funding the gates, who bears that, shared cost perhaps, and maintaining, managing the padlock, and whoever has to have a key, and then obviously planning permission may be required.
Right. Okay, and how long would something like that take?
Okay, if it was a city council public right of way, my honest answer is it probably wouldn't get done. If it did and was justified, it would probably take about 2 years after any other interventions have been tried. That's just based on the experience of one I had previously. And possibly similar if it's housing. If it's not, if its status is that it's classed as private, it's just residents have a right of access, then there'd need to be a lead person, somebody to take ownership, to consult or liaise with all other people who have a legitimate access to it. And once they get the collective agreement, which could take a week or a few weeks, and then putting, providing the funding's there, putting in for planning consent. I think that can take up to 8 weeks to determine. That's certainly the best outcome would be, in a way, if it was private and the residents got together and sought the planning consent and it went in. That is the quickest way, but it depends on its status. That could just be a few months.
Okay. Carl, I'm trying to see if there are any other questions.
Well, I can stay online but muted.
Yeah.
And if you want to come back at the end.
I may want to come back at the end, but at the moment I can't see any further questions. So can I thank you for taking the time out to come to this first remote meeting? We're learning as we're going along, I'm telling everybody. So thank you very much.
You're very welcome.
Can we move straight on to questions? Now, the police have been in touch, and the question they want to find out is, as a community, regarding the things that have happened in America with George Floyd and other things, how are the community and things in the local ward, how are the community feeling at the moment? That was the question asked. Now, I don't know if I've had any answers to that, but that was a question posed by Sarah from the police. Unless I've got that wrong, Neil? I can't hear you, Neil. You're muted.
That's correct, Councillor Hamilton. No, that's the question that came through. The police just want to get a general sense of how the community are feeling, and also to find out if there are any localised issues that are occurring. And they apologise. Their technology, unfortunately, hasn't allowed them to join and present. But what they said is that they will forward a more detailed update following the meeting to all the people that are registered with us.
Okay, that's fantastic. So is there anything that's pressing that anybody'd like to put into the chat bar?
And Councillor Hamilton, if it helps, some of the local intelligence that I'm kind of picking up and comments from local residents, that there are things around, drug dealing around kind of parks and kind of places that are secluded. There are issues around litter and waste, particularly in parks as well. And also people are really concerned about gatherings that have happened in the good weather, today not included, where people are gathering in large numbers. And in light of the George Floyd incident that has occurred, there are a number of planned, if you like, protests and what have you that are circulating within the community. So people are just concerned really around large gatherings and social distancing and litter and rubbish and what have you. That's the general type of comments that I'm picking up.
Well, just to respond to a few of those, because I have been linking in with the police, just so that residents are aware. Regarding the large gatherings, we did have a massive one up at Newings, and that particular gathering was beyond a joke. It was a large number of young people that decided to have a block party, and when asked why were they having this block party, they said, well, they thought COVID was over. So my issue with all of that, and I'll tell residents now, is that I shouldn't really say this, but the issue is not the young people themselves, and I understand that they're frustrated, but if they're carrying the COVID-19 virus, they are taking it home to their parents, grandparents, and other members of the family. And even though through the report that was published yesterday, It's made it absolutely clear that if you're over 80, you are far more susceptible and from an ethnic minority group. But if you're under 40, it says that you are very low risk. That hasn't really helped to get the messaging right, because with the government moving from lockdown to stay alert, that's confused things. With Dominic Cummings then driving 250 miles to go and stop in a cottage, that's confused things. So at the moment, our young people are just very confused. Let me be honest. And so in the ward, we've had a number of incidents, predominantly with African and Caribbean young people that have just absolutely broken the rules. And we've also had some issues going on at Hilltop, where they've gone up there in cars and been having like outdoor parties. So regarding Hilltop, they've changed the locks on the gate so that people can't get in, to stop that one. Up at Newings, the police were absolutely excellent, and they've worked with the young people, they've worked with the residents to sort the party atmosphere out. There were no arrests, and the approach they took was absolutely spot on, and it managed to get rid of the crowd and to potentially stop a situation which could be quite dangerous. We then, on Monday night, we had a vigil on Soho Road, which again was another hot spot that could have happened by Cannon Street Church. Now, with that particular incident, and it wasn't really an incident, people felt very strongly about the George Floyd incident in America, and they wanted to come out and they wanted to show support, but it wasn't really very well organized. The organizer was somebody that wrote a WhatsApp message, put it on WhatsApp, and it just went viral. So the gentleman who actually did it really did not think it through. So it was somebody that is known to me. So one side had a word with him, and I can't take all the credit, but others also had a word with him. He decided to put a retraction out, but by this time the word had got around. So relating to the incident on Monday, we had about 80 people turn up, but I'm pleased to say the incident went off with no issues. People want to just show their hurt, but I just didn't think in front of Cannon Street Church on a main road was where you did that. There is another event tomorrow night. I think it starts about 5 o'clock till 9 o'clock in front of Victoria Square, where the Black Lives Matters people have organised it again. Getting the intel on this, I believe it's something that was put onto social media and it's just become viral. So there will be large numbers of people down there, but I don't think it was truly organised. And I think it's a lot of young people through the universities and what have you that has decided to do this. So I might be going down there tomorrow myself. But it really is because I do feel that it's an important, we have to show that we support this particular issue about lives mattering, but also I know that there will be people down there, and I just feel as a councillor that it's something I should go to. I have to say my biggest concern, if I'm speaking to residents, it's around social distancing. The fact that tonight I'm saying to you all, it isn't over. COVID-19 isn't over. People need to keep washing their hands. They need to keep socially distancing as much as possible. Well, it's 2 meters. They need to stay 2 meters apart. Now, on Soho Road, and Carl, you might be able to come back in with this one. Will we be doing any of the widening of the the roadways on Soho Road to ensure that the cars don't rule. I know that we've put a lot of ballards up on Soho Road, but so that people can do the 2-meter distancing, will we be doing any of that work on Soho Road? So there is that issue. And also in Answorth, in Holyhead, I've had large numbers of issues, parties in people's gardens with loud music and barbecue. I've had loads of complaints about antisocial behaviour, people weeing on walls, doing other things up alleyways, people dumping rubbish, people not being respectful of other residents. So we've had a number of streets where we've had large numbers of concerns. I have linked in with the police and they are looking at all of these. What I've done is I've said to residents, please contact me if you've got a number of an address or something where this sort of thing is happening. And tonight I'm saying to people online, if you have got neighbours that are behaving in an antisocial manner, please let us know. And my final reflection before I bring Carl back in, we've had a number of issues on Regent Road at a number of houses. I won't say the number of the houses because I don't think it's fair online, that we've had a number of issues relating to antisocial behaviour and also relating to drugs and different things. Can I just say to residents online, if you live in and around Regent Road, it is being dealt with. The police spoke to me about it even yesterday. So at this point, I'm going to check what's in the chat box and I'm going to hand over to Carl to just talk about what measures are being done on Soho Road. Thank you, Carl.
Okay, thank you. As I mentioned earlier, the roads that were deemed to be a priority, and we did assess Soho Road, the roads that were most urgent to do was Erdington High Street, which in the height of the lockdown did resemble a typical Saturday afternoon, unfortunately. Kings Heath High Street, Ladypool Road. The next phase is looking at, I think it's around 25 locations, and that does include Soho Road. As you've quite rightly pointed out, a lot of money has gone into Soho Road for the measures to try and stop the vehicle parking on Soho Road, so all the planters and bollards and other measures that have gone in place. This was all pre-COVID, of course. Specifically what will be drawn up for Soho Road, I don't know. Colleagues are working on, there's a group working on about 25 of these locations, and the detail, there's just too many sort of local centres for me to be looking at, or my team. There's something like 250 of these, and my team are looking at half a dozen, and other people are looking at others. So yes, there's measures going into the next phase, but exactly what I can't tell you at this stage. We'll have to see what comes out from the design.
Okay, that is fine. Thank you for that.
Sure.
Can I also, I have put it in the chat box, but I didn't realise that I'd be talking so much. I know that Ross from Holyhead School is on the line, and I just wanted to know if he could put something in the chat box to say whether or not the school has opened at all, because I'm not sure, I've not heard anything to say whether Holyhead is open or not. And could I just say publicly, I'd like to thank Ross for all his support, especially at the beginning of this lockdown, because we had a number of issues, families that were struggling to eat. And I went to the school and they gave me, over a 2-week period, over 200 meals so that we could feed families in the ward. And that wasn't all he did. He was giving food to the homeless shelters and to others, and it was a really good thing to do, because at the time we really hadn't got things in place where food could be distributed. And even when I had other families through Nina that were struggling, and I want to say thank you to people like Nina and Ian Bell, who without them I just would not have been able to get round and support people that were struggling. And Nina actually went to the school on my behalf, and she collected food so that some of our residents could eat. It's been a hard time in the Holyhead ward, but you know something, we've had some brilliant residents who have absolutely gone over and above. And I just want to thank you for everything that you've done over the last 8 weeks to support residents in this ward. And then finally, it's just such a shame, but I wanted to have Khalid come in to say a few words about what he's been doing as the MP in the area, because Khalid has been working quite hard, even though he's been shielding himself. He hasn't really stopped, to be honest, and but it's such a shame we can't get him online. So we really do need to sort out the issues re-getting some of our presenters online. I'm not sure what's gone wrong, but we haven't been able to get him online. Neil, has anybody, has Khalid sent any messages to say that he wants anything said?
I do apologise for that. Not sure why the technology has let us down in terms of the invite. No, I've been in dialogue, and I sent another link, but unfortunately that hasn't gone through. So maybe in the time that we've got left, he may be able to email through kind of any quick comments or anything that he'd like us to update. So I have done that to a few people that haven't been able to log on. Councillor Hamilton.
Right. Now, is there anybody else that has any other questions? Well, the only thing I can do is probably spend 5 minutes while people are writing in the chat box to just talk a little bit about the city brief that I hold, because I do think that's been quite interesting. Khalid's ringing me via WhatsApp, so let's see if we could get him through the, hang on. Khalid? Right. Now, is there anybody else that have any other questions? Khalid? Khalid, do you want me to see if I can get you online? Khalid?
Councillor Hamilton, if it helps, what you can do, you might want to mute, and I can give a little bit of an update from a neighbourhood network point of view. Is that all right?
That is absolutely brilliant, because
okay. So let me just go live for a few moments, and I'll give a little bit of an update.
Thank you.
Good evening, all. Obviously, this is a bit impromptu in terms of my update, but I just wanted to give you an update in terms of neighbourhood network schemes and the fantastic response from our local volunteers and communities in regards to COVID-19. And I know that there are people like Ross and Nina, who Councillor Hamilton has mentioned before, but Perry Bar is one of two kind of neighbourhood network schemes that Birmingham City Council is responsible for delivering across the city. Now, neighbourhood network schemes are funded by adults and communities, and for about the past year and a half now, both Ladywood and Perry Bar have been delivering a number of services and funding a number of services so that people within their communities have access to health and well-being opportunities. Principally, it's for persons over 50, and there are lots of referrers that come in from social workers and also GPs and everybody else into the neighbourhood network. And the neighbourhood network is principally voluntary and community organisations that are neighbourhood based that are providing a range of services. Now, during the pandemic, we've had to change our focus really and to link in with a lot of the voluntary community sector organisations and to support them in terms of their fantastic response to the need within our neighbourhoods of vulnerable people and people that are suffering from abject poverty and people that are suffering from mental health and other issues. And the good thing about the response in Holyhead ward and across Perry Barr constituency is that members of the public and volunteers and what have you have just got up and got on and supported their communities. So there are a number of projects that we've grant funded, and there are a number of projects, as I say, across different types of faith groups, local volunteers, etc., that have been providing food, support, advice, guidance, in addition to all of the other provision that has been provided by Birmingham City Council and a number of other providers as well. So again, we would just like to say a big thank you as council officers for the fantastic efforts that are actually happening and that are taking place. And we need to kind of capture all of these good things to help us in terms of what we're going to need for transition and recovery out of the pandemic. I'll be writing a report, and there are other kind of research and different studies and things like that that are taking place within Perry Barr constituency and also across Birmingham in relation to the pandemic. But I can't stress enough how people have just been completely unselfish and have gone out there and really supported communities and you know, provided for persons in need. So hopefully that gives you a little bit of an overview. I'm quite happy to take any questions personally via the chat or via my email address afterwards. And hopefully, Councillor Hamilton, that has kind of helped to provide a bit of a context as what we've been doing as a council, but also how we've been linking with the voluntary and community sector. You're muted, Councillor Hamilton. So
right.
Oh, you're muted again.
Can you hear me now?
We've got you now.
Right. Can I also ask you, while you've got me, can you let Khalid in? Because he said he's waiting to be let in. Right. Can I just say, and I have to apologise about this, technology is not always as good as you think it is, but the voluntary sector have been phenomenal over the last 10 weeks. They have gone over and above what it could ever be asked of any single person in this city, across the city. Tonight, I'm specifically talking about the Holyhead ward, but across Perry Barr, across the whole city, the work that has gone into ensuring that we keep things moving has been phenomenal. Residents that are part of the clinically shielded, it has been a army that's gone out there on a voluntary basis to help with our most vulnerable groups to ensure that they've continued to get food, and also the work that has gone on within the children's services and within community cohesion, within the neighbourhoods, with the homeless. It has just been phenomenal. And I as a councillor, I can't tell you how humbled I've been over the last 10 weeks to serve as a councillor in Birmingham. I have been truly proud of what the citizens of Birmingham have been doing, to the extent where we've been seen as national exemplars with some of the voluntary work that we've been able to get off the ground in very short spaces of time. So I'm just saying well done to everybody, because this is, I've always said it, there is no I in team, and sometimes you may see people like myself that front these things, but there are an army of people behind us that are the unsung heroes that are actually doing the work. And so I'd just like to say thank you, and I'm hoping that Khalid is actually in, because he did want to say a few words tonight. Have we managed to get him in?
I do apologise. I can't see where his invite is to accept him.
Okay, all right then. There isn't a lot I can do unless I've got any other questions. I can't see any questions. Can you, Neil, that I've missed?
No, not at the moment. No.
So I'm ever so sorry. Three of our speakers were unable to get in tonight, but we've managed to conduct the meeting as best we can. So I am going to finish the meeting early because we can't get our other speakers in. And unless Neil has got anything to say, I'm going to actually say good night because we have no other questions.
No, I haven't, Councillor Hamilton. No.
Okay.
Yeah.
So I don't have to say to everybody my usual statements, have a safe journey home, because I know you will have a safe journey home. I cannot apologise enough that Khalid wasn't able to get in, because he really did want to speak to the residents in the ward. So Khalid, I'm saying it formally online. I'm really sorry you haven't been able to get in, but this has been a bit of a what do you call it? This has been a bit of a pilot. So thank you to Carl Randall for coming on. Thank you to Neil and Bev, who have been the producers in the background. Thank you so much to Justin, who has managed to get on and give us an update. But more than that, thank you to all of you out there who have taken the time to join this meeting tonight to see what's going on in the Holyhead ward. And on that note, I'm going to say good night and thank you.
Thank you, Councillor Hamilton.
Thank you.
Thank you all very much. Good night.
Yeah.
Good night. All the best. Good night.